Let's move on to the next speaker, and that is Dr. Su. He's an associate professor at the Department of Nutrition and Epidemiology at Harvard School of Public Health. Also an associate professor of medicine at the Channing Division of Network Medicine at Brigham Women's Hospital at Harvard Medical School. Dr. Shikun, its primary research interest was to identify and expanding biomedical risk factors, particularly dietary biomarkers in relation to type 2 diabetes, obesity, and cardiovascular disease through epidemiological studies. It's mainly working on large-scale cohort studies, such as the North Health Study and health professional follow-up. There are many folks here today. And he's also leading currently several NIH on food biomarker discovery and validation, and also relationships between obesity and weight change in human populations. And today we will hear a talk about the food intake biomarkers in the era of precision nutrition. Welcome, Chief.
Thank you very much, Rikard. I want to thank the organizing committee for inviting me to give this talk. Very nice to see so many friends in the audience. So I will start my talk by talking about food biomarker discovery work. First of all, this a terminology issue. So I think I don't think there's a well-accepted definition of food biomarkers, but nonetheless, too many food biomarkers are biomarkers that can sensitively reflect a specific food or food group, with some implications with this definition that ideally the food biomarkers should be compounds that naturally exist in a specific food, but not in other foods. And they do not have to have any biological effect, could be just very neutral, simply reflecting the intake of the food. But also, this definition implies that, ideally the food biomarkers should not subject to strong modulations by other factors, including genetic factors, microbiome, so on and so forth, so that the food biomarker have more wider generalizability, can apply to many populations as a valid assessment of intake of food. This slide summarizes the typical pipeline for food biomarker discovery, validation, examination work. By no means this is the only timeline pipeline, but people would start with acute feeding study by giving participants a really huge dose of a single food and collect their samples in next 8, maybe 10 hours. Sometimes ask them to come back at a 24-hour to finish the collection. The goals are twofold for this acute feeding study. One is to generate a promising list of features, so that you can focus in subsequent study, understand their chemical identity. The second goal is with the repeated assessments of the same feature or same marker in those samples, you can characterize their pharmacokinetics parameters. For example, the half-life, the Tmax, so on and so forth, which are very useful parameters to understand for any biomarker. Then people would carry on to conduct a second trial called dose response trial by giving participants different doses of the same food. So the purpose of this trial is to really narrow the list of promising features. You would want to focus on the features that also give you a reasonable dose response, so that you then you conduct experiments, metabolomic profiling, chemical experiments to understand the identity of the features, what kind of metabolites are they. Then finally generate the curated data set of food biomarkers plus other metabolites. But story shouldn't end here. Then it should carry on in free living individuals to understand the reproducibility, the stability, but very importantly, understand the sensitivity and the specificity of the biomarkers in free living individuals. Then if everything pans out, carry on to examine the food biomarker in relation to various health outcomes that are relevant to that food. So I'm going to switch gear, talking about the Dietary Biomarker Development Consortium. I think many of you are involved in this EU's football consortium. Now, by the way, this kind of consortium is really, really useful for food biomarker research, given that people can convene together and discuss and exchange ideas and sometimes standardize approach to facilitate the food biomarker discovery. The United States is a bit late, but nonetheless, this is, to my knowledge, the first consortium that really dedicated to the food biomarker discovery and validation. This consortium is funded by US NIH, but also USDA, and they have 3 centers, one at Harvard School of Public Health, the other at Seattle, and third at UC Davis. So this is a list of food that this consortium will tackle, will focus to understand what kind of biomarkers may find to reflect intake of those foods. I count 15 for this consortium. This is really the acute feeding study design that implemented by the Harvard Center. So again, we have a running phase, then we give participants really a bolus dose of a test food, and they collect their blood samples, urine sample in the next 8 hours, because the burden may just shrink from 10 hours to 8 hours. And by the way, we would ask participants to come back at next morning to give us a final fasting blood sample and finish the 24-hour urine collection. I'm very glad to report this trials are done in this year, in April. Kudos to those 2 leaders of the trial, Kathleen Johnson and Jonathan Williams. So this is our design for dose response feeding study. We have 10 foods to focus, but we have really limited budget. So we want to design this trial efficiently by pairing the 2 foods together. Idea is that plant-based food versus animal-based food, their metabolic signatures often do not overlap, so that you wouldn't confuse yourself. By pairing the high dose with low dose, the medium dose with the medium dose, easier to control the energy intake, make it constant. So this is the feeding studies, which are still ongoing at Harvard. Hopefully we can conclude all the trials within 1 year. My next topic is about the evaluations of food biomarkers in epidemiological studies. To me, this is a really, really critical component for the pipeline in food biomarker research, simply because trials are very valid, however, very expensive, but also not extremely efficient, because each trial can only focus on 1, maybe 2 foods. But epidemiological studies can really be complementary to the research in food biomarker study, complementary to trials. So here I want to mention a very unique sub-study embedded in the nurses' health studies and health professional follow-up studies. For the sake of time, I just want to highlight the unique feature of this study is that we collected 2 sets of 7-day diet record. At the same time, when we collected the diet record data, we also collected plasma samples and fecal samples and urine samples, so that because the collection of the biospecimens and data are coordinated, synchronized, we may be able to link the diet with the microbiome, with the metabolome in urine and plasma. So we just focus on protein baiting. As many of you know, protein baiting is really solid biomarker of citrus food, especially citrus orange juice intake. So in our epidemiological studies, we understand protein baiting is very, very robust to the sample collection conditions. They do not degrade. In free living individuals, when we test the protein baiting in small urine samples collected 1 to 2 years apart, we still observe a reasonable correlation coefficient over time, meaning that potentially one single assessment of protein baiting may reasonably reflect the intake of orange consumption. And this is a roughly crude. I have more detailed data, but here I want to demonstrate that the protein baiting is specific to the intake of fruits, but not necessary to vegetables and other foods. So this is a demonstration that the epidemiological study is often very useful to test specificity. And use the the tried method, you can really demonstrate that protein binding indeed is correlated with the true intake. But interesting component part is here. That is that the 7-day diet record is such a gold standard in the correlation coefficient with a true intake was close to 0.95. Even FQ is demonstrate the correlation coefficient stronger than the urinary protein binding. Here, I'm talking about orange juice intake. So I think in next couple of years, we will understand this phenomenon in greater detail. But also with the 7-day diet record data, we're thinking about maybe we can demonstrate how valid those data are by developing a calibration equation using the protein binding using the 7-DDR assessed citrus fruit intake. And for the sake of time, this is the equation we developed in this lifestyle medicine study. And this is the equation that Lauren Brandon's group developed through a dose response feeding study. And as you can imagine, of course, you wouldn't expect the numbers exactly the same, but they are close enough. One explanation is that maybe you're just lucky, right? Next good thing to do is to buy lottery, then you hit jackpot and retire. But the alternative explanation is that maybe it's because 7-day diet record data are really, really solid. It truly reflect the intake at the time when you collect urine samples, so that you can really use the solid data to develop a calibration equation, which is very similar to that divided through the trial. And those are existing studies and much cheaper than the clinical trials. Have a few minutes left. I want to fly through the slides. So future directions, I want to demonstrate a few studies and really ongoing, none of them published. So this is an interesting analysis. Again, in the LVS, use the 7-day diet record data. We derive the plant-based dietary indices, including the healthy plant-based index, unhealthy plant-based index, so on and so forth. So Lauren Brandon gave us unnamed features through her NMR platform. And without knowing identity, we just say whether we can use the features to demonstrate, to build an index that reflect HPDI, UPDI, so on and so forth. And indeed, we can reasonably build the indices using sometimes 50, sometimes 60 features, and pay attention to the blue bars. Those are correlation coefficients with the HPDIs. Or PDI assessed using 7-DDR, and this correlation coefficient really, really impressive. And this is replicable in the SONUS, which is a substudy in the Hispanic SO cohort, use exactly the same feature. We can also measure the occurrence to the HPDI, UPDI, so on and so forth in this Hispanic cohort. And pay attention to the fact that in this cohort, we only have 24-hour recall. Twice to assess that, and with that limitation, it's really reasonable to observe this correlation coefficient. This is another tried demonstration showing that this index is very reasonably correlated with the true intake, quite comparable to that for FFQ. And lastly, this index give us associations with coronary heart disease in a very expected direction. This is a UPDI, this is HPDI. The green bars represent associations from our cohort analysis. One point is that, for our case study, only several hundred case control pairs, but in cohort study, tens of thousands, hundreds of thousands participants follow up for, 3 decades, observe similar association. That's how powerful the index are. So very quickly, congratulations to Clemens for the publication and Nature Medicine. We use a 7-DDR data to also demonstrate that you can use really multi-markers to reflect saturated fat intake, but also monounsaturated fat intake. I don't think we have really solid marker for the saturated fat and monounsaturated fat intake. Some of the markers are maybe overlapping with Clemens index, but others are quite unique. This is just to show that the total saturated fat intake, total monounsaturated fat intake, the correlation coefficients with the diet record is quite impressive. We're looking for cohort studies to replicate this. This is just a couple examples to demonstrate you can really use innovation. This is the plant meta-barcoding richness can measure HPDI really well. This is a ethyl glucuronide to measure chronic alcohol intake, and this is a laser ablation inductively coupled MS to really use baby teeth. You find the location, take the sample, and you can measure heavy metals very specific to a very specific time at during nutrition during pregnancy. So calculations, self-explanatory field biomarker research of course holds a promise of discovering novel and biomarkers that are sensitive, specific for refracting food intake. But much work is needed to evaluate performance, and epidemiological studies can help in this research, and multi-marker indices that consist of both endogenous and exogenous markers may be used to measure intake of nutrients, foods, and dietary patterns. And I want to thank my colleagues. Some of them sit in the audience, and thank you for your time.
Excellent.